Yo, it's Seabass, PGY5 Kidney Fellow. Let's celebrate late-stage capitalism and electrolyte disorders together. I will teach you 2013 fast fashion and 2023 hyponatremia. What clothes are in my tote? What's one big mistake that most hyponatremia schemas are making? Stay tuned to find out with this Hyponatremia Haul.
Kidney Bass topic.
The schema that I like places an emphasis on a conceptual understanding of the 4 essential data points of hyponatremia. So what are those 4 essential data points? Well, they are, in order, the serum sodium, the serum osmolality, the urine osmolality, and then the urine sodium. You might ask yourself, well, Seabass, I might have problems remembering all 4 of those data points. If that's you, I have a special framework that I want you to try to visualize. No, it's not a mental model, it's a literal picture. Just give me a second. All right, so here's the 2x2 grid. On one axis, you have either urine or serum, and those are depicted by the blue and red fonts respectively. And then on the other axes, you're going to have sodium and osmolality. Then all you have to do is basically find where the 2 axes intersect to get the corresponding 4 essential data points for hyponatremia. Let's systematically go through each one of these data points by starting in the top right corner and working our way clockwise. Dope. I got a black American Apparel hoodie. Okay, so first up is the serum sodium. If we are framing a clinical problem as #hyponatremia, then it seems kind of obvious that you're going to have a serum sodium. The key here, though, is that you need to adorn Mr. #hyponatremia with a certain amount of adjectives. Otherwise, he's naked. The 3 adjectives that I always consider are chronology, symptom severity, and biochemical severity. For chronology, if you're lucky enough to have a basic metabolic panel in the past 48 hours, then you might be able to label the hyponatremia as acute. However, most of the time, we are not so lucky. And so the risk-adverse strategy is to presume that the hyponatremia that you're dealing with is chronic. Next up is symptom severity. So for severe symptoms of hyponatremia, I want you to think about overt seizures and severely depressed mentation. When we're thinking about severely depressed mentation, we can think of things like a GCS less than 8 or frank coma. Many practitioners also consider emesis or vomiting to also be a severe symptom of hyponatremia. Following this would be moderate hyponatremia. These will be things like nausea or a slightly depressed mentation. Here I want you to think about conversational encephalopathy. Everything else, all other symptoms of hyponatremia, will simply refer to as not severe. Notice what I did there. I didn't say asymptomatic. And that's because even a mild hyponatremia can drive subtle, subclinical symptomatology that's not detectable to the naked eye. Instead, it requires a battery of formal cognitive tests to be detected. Finally, for biochemical severity, I use a stoplight approach. So for numbers of serum sodium that are above 130, I am visualizing a color green. That is to say, not too worrisome. For numbers above a 120, I'm visualizing a color yellow. Okay, I need to take it seriously, but I have a little bit of time to think. For numbers that are under 120, I visualize a red. This demands my immediate attention. Putting it all together then, you might give me a call and say, yo, Seabass, I have a new consult for presumed chronic, mildly symptomatic hyponatremia with the most recent serum sodium of 123. Mic drop. This black American Apparel t-shirt is called Le Big. Next up is the serum osmolality. This is essentially a quality control metric. That's because the serum sodium is the largest driver of both the total serum osmolality and the total serum tonicity. What that means is if we're dealing with #hyponatremia, then we're expecting a low serum osmolality. So most of the time, it will be the case that the measured serum osmolality is low, just like we would have predicted. In these instances, all you have to do is measure the data point once, confirm the hypothesis, and then you can move on. Sometimes, however, the serum osmolality is not what we expect. It's either in the normal range or it's in the high range. Then we need to spend a little bit more time thinking about why that might be the case. By far, the most common example of a hyperosmolar hyponatremia is going to be hyperglycemia. I'm Happy Henley in black. Buttons make it business casual. Third is the urine osmolality. So if I were to ask you, what does the urine osmolality represent? What does it mean? You might reply to me, the concentration of the urine. In fact, that's the most common answer to that question when I pose it to trainees when I'm teaching this topic. Now, while you would not technically be wrong to say the urine osmolality is the concentration of the urine, I want you to shift your mindset about this so that we can level up your skills. I encourage you to think of the urine osmolality as a surrogate for ADH activity. These two things are directly or positively correlated. So what that means is that the higher the urine osmolality, the more ADH we presume to be around, and the lower the urine osmolality, the less ADH we presume to be around. Most cases of hyponatremia are driven in part by ADH activity. This makes the urine osmolality particularly useful when we're examining the differential diagnosis for hyponatremia. Because if you have a super low urine osmolality, then your differential diagnosis becomes very short. It includes things like primary polydipsia and tea and toast diet. Black brimless cap, aka beanie, also am happy. We're finally here. Our last essential hyponatremia data point is the urine sodium. In the context of hyponatremia, we use the urine sodium as a surrogate marker for the RAAS hormonal axis. If the renin-angiotensin-aldosterone system is on, then the kidney is going to hold on to as much urine sodium as it can, making the measured value low. If, however, the RAAS axis is off, then the kidney will spill urine sodium and the measured value of that urine sodium will be high. So why is this important? Well, we want to see if there's concordance between the ADH axis and the RAAS axis. One of the stimuli for ADH is in fact decreased effective arterial volume. So in the instance in which we see that RAAS is on, it makes sense for ADH to also be on. If, however, we see that the kidney is spilling urine sodium, then it doesn't quite make sense for ADH in the context of hyponatremia to be on, and we might instead call this ADH activity inappropriate. This black am-appy scarf is called indie sleaze, which is what Gen Z calls my college years. Hey, so it's time for the recap, but before we do, I promised that I would share the biggest mistake that most schemas for hyponatremia make. So here it is. Before you do this 4-step process that we just spent the last few minutes talking about when working up a hyponatremia, you need to take a look at the serum creatinine. That's because if the patient is ESKD or they have severe AKI, then the etiology of their hyponatremia can only be one thing. There is hypotonic fluid that's going into the patient, and they do not have kidneys that can clear hypotonic fluid. Another way to say this is you need a GFR in order to clear hypotonic fluid. So let's hit those 4 points one last time. We are going to visualize the 2x2 grid to remember the 4 essential data points for hyponatremia. When we look at the serum sodium, we need to make sure we're ascribing to the hashtag hyponatremia a chronology, a symptom severity, and a biochemical severity. The next thing we're going to do is look at the serum osmolality, and that's going to serve as essentially a quality control check. because we're expecting to see a hypoosmolar hyponatremia. Next up is going to be the urine osmolality, which we'll use as a surrogate marker for ADH activity. And last but not least is the urine sodium, which we're going to use as a surrogate marker for the RAAS axis. I am beyond stoked to make asynchronous med-ed video content for internal medicine house staff. If you learned something today, smash the subscribe button or toss me a like. Here is another video that you can check out that might be of some use to you. Thanks a lot. I got a black American Apparel hoodie.